point, let me invite the chairman of the Presidential Task Force on COVID-19 to make his remarks. Mr. Chairman.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, from the introductory remarks of the Permanent Secretary GSO, it looks as if we have a very full evening. Let me welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday 20. No? Today is Thursday. For Thursday, 27th August 2020. Exactly 6 months ago, on February 27th, 2020, the Honorable Minister broke the news of Nigeria's index case of coronavirus from Ogun State. Immediately after that announcement, knowing our very frail state of health facilities, the federal government, under the leadership of President Muhammadu Buhari, started putting in place containment measures to help meet the challenge that had started crippling economies and exposed inadequacies even in the best health systems. It is with all sense of modesty that I wish to state that Nigeria has done remarkably well, but could do exceedingly better, as captured in Mr. President's speech during the World Health Certification Free Status for African Continent, when he expressed optimism on our fight against the pandemic, and I quote, "At a time when the global community is battling the COVID-19 pandemic, this achievement, that is eradication of the polio virus, strengthens my conviction that with the requisite political will, investment and strategies, as well as citizens' commitment, we will flatten the curve," unquote. As we enter the last week of this extended eased lockdown phase, and note the impressively declining fatality ratio and reduction of confirmed cases, the Presidential Task Force would also like to draw our attention to a subtle change in the epicenter of the virus. We all recall that Lagos, Kano, and Ogun states were the initial epicenters, and this to Uyo at a time, and now Plateau State. As mentioned by the Lagos State Commissioner for Health and a notable COVID-19 warrior, Professor Akin Abayomi, Lagos has passed its peak, but we call for vigilance and cautious optimism because the scourge is not over yet. Our strategic objective still remains to test samples in high numbers across the entire nation. It is therefore in the above context that the Presidential Task Force re-emphasizes our often repeated calls to every citizen to take responsibility by complying with all guidelines and non-pharmaceutical measures, including wearing of masks properly, maintaining social distances, avoiding large gatherings, maintaining regular hygiene practices, and most important, staying at home for the most vulnerable. As we keep to these simple protocols, our individual and collective efforts at balancing lives and livelihoods would achieve its intended benefits, especially now that we have opened a lot of sectors and opening more sectors in the coming days and weeks. Recently, the National Bureau of Statistics released the second quarter 2020 performance of the economy. It showed that the gross domestic product GDP slumped to minus 6.10% due to the impact of COVID-19 on oil market and other variables. This underscores the impact of the pandemic on the global economy. As we have often repeated, the pandemic also presents us with opportunities and impetus for innovation, creativity, and industrial development. For existing businesses of different sizes, we wish to remind you that government has approved an economic sustainability plan containing stimulus packages for businesses to access. As we prepare to reopen the international airspace, therefore, we are optimistic that the economy will continue to improve along the value chain as goods, services, and passengers move across borders. The aviation sector, no doubt, provides a window to the world, and a shutdown of 23 straight weeks obviously impacted negatively on the economy. Today's briefing has been packaged to underscore the level of transparency with which the resources deployed for the fight against COVID-19 have been put to use. As part of this briefing, the Presidential Task Force, the PTF Transparency Initiative dashboards will be launched, and that explains the presence of our development partners here today. This is a significant milestone because it puts valuable information at the disposal of every Nigerian. The PTF wishes to use this opportunity to thank the increasing number of discharged persons who have been sharing their experiences, the print and electronic media that have been supporting our risk communication and community engagement strategies, as well as the numerous partners that are sustaining the message. Before I call on the Honorable Minister for Health, let me, by extension, thank the media for the great job that you have been doing. Today, after I briefed the Council of State on the national response and the robust and effective coordination that has taken place in the last 6 months, the PTF received a commendation for having really sustained the national response and deepened its ownership across the nation. As a matter of fact, one of the former presidents did attest to the fact that on a daily basis, when we were briefing daily, he looked forward to the briefing sessions. And when we reduced it to 2, whenever time and engagements permitted, he would sit and watch and listen. And he received valuable information through that processes. By extension, you are the ones that have carried the message to the homes of citizens, to their offices, across the length and breadth of this nation. So I want to thank you, distinguished gentlemen of the press. I now have the honor to invite the Honorable Minister for Health, thereafter the DG, Nigerian Center for Disease Control, or person representing him, and the national coordinator. Subsequently, they will come up to provide you with the technical details. And immediately after the technical updates, The launch of the transparency portal shall take place before we take your questions. I thank you so much for your attention and have a very pleasant evening. Thank you.
Good afternoon. The chairman of the Presidential Task Force on COVID-19 Response and Secretary to the Government Health Federation, honorable ministers and members of PTF, the national coordinator, the country representative of WHO, permanent secretaries, directors, ladies and gentlemen. As of today, the 27th of August 2020, we have recorded 53,021 COVID-19 positive cases out of 391,502 samples tested, while 40,281 persons have been treated and discharged. Sadly, we have lost 1,010 persons to the virus, with a case fatality rate that remains at about 1.9%. The global trend in figures is unrelenting and progressing as many countries seek the best way to preserve lives while relieving the pressure on their economy. It is critical to find a delicate balance between the two sides, as some countries who have miscalculated this equilibrium were forced to change their ways and retrace their steps, or suffer a second COVID-19 wave after reopening their economy. We are continuing with plans to reduce case fatality rate to less than 1% by optimizing response activities and cooperating with states according to the challenges they face, which includes a review of the status of the treatment centers, isolation centers, and ICUs. To this end, a grand virtual meeting with all CMDs and medical directors of federal hospitals in Nigeria is scheduled for next week. A new state molecular laboratory is currently being optimized in Kebbi and Bayelsa, while gene expert machines have been set up at National Hospital Abuja and the University of Abuja Teaching Hospital Gwagwalada, as was announced some weeks ago, which means that suspected COVID-19 emergencies can now be diagnosed on site within 1 hour. And you have the result. And this will drastically reduce the turnaround time and waiting time to allow better utilization of observation rooms in the hospitals. This is a major advancement in handling the distress experienced by patients arriving as emergencies in these hospitals who will normally have to wait for a day or two before they get their result. The University of Abuja Teaching Hospital in Gwagwalada has also found access to supplementary medical oxygen supply, courtesy of the generosity of the Nigeria Air Force, who supplies them with oxygen from their plant in Yola. On Tuesday, the 25th of August 2020, Africa was certified polio-free, having passed through the formal standardized certification process, where Nigeria was the last of 47 member states of the African region to meet the criteria. These include no wild poliovirus detected in the last 4 years in Nigeria, but also an obligation on us to faithfully adhere to keeping and expanding routine immunization and active disease surveillance and containment. This achievement was made possible with the strong commitment of the President of the Federal Republic, who personally vaccinated his own grandchild to openly demonstrate that those few drops of vaccines are not harmful but life-saving. His Excellency also delivered a virtual keynote address at the formal event and accepted the certification as a fulfillment of his own promise that he would not bequeath a polio-endemic country to his successor. We are appreciative and proud of this achievement of being polio-free, and I thank the staff and management of National Primary Healthcare Development Agency for all their efforts and sacrifice. We shall not relent in our efforts to ensure that Nigeria remains polio-free. We shall be deploying the material and human resource assets from the polio eradication effort to surveillance and fighting other disease outbreaks, including the fight against COVID-19 pandemic. Nigeria also participated in a World Health Organization African Regional Conference held virtually due to the demands of the time and chaired by the Minister of Health of the Congo. I led the Nigerian team and participated in discussions which centered around various subjects, including COVID-19 and progress made in conversations around vaccines and implementing the African Regional Sickle Cell Strategy. We shall sustain our interest in development around COVID-19 vaccine as the world seeks opportunity, and discuss with other countries as the world seeks opportunities to exchange ideas with countries and organizations investing in new knowledge. Training and retraining on infection prevention and control is ongoing in all our facilities, as well as ensuring availability of personal protective equipment as an investment to continue the reduction in health worker infection. I renew my call on all our health workers to ensure judicious and prudent use of these PPE materials while observing their full IPC measures. Finally, I wish to remind all of us that COVID-19 is still with us and might be for a foreseeable future till there is a vaccine available for it. We are exploring options and opportunities to see that when the vaccines are available, Nigeria will be among the beneficiaries. The NAFDAC is also pursuing, trying to reach the international maturity level to assure that the products and processes that come out of research work in Nigeria towards development of vaccine candidates are realizable and that they meet the required standards. With the imperative to reopen the economy, relax local and international air travel to support restoration of livelihood, the experience in other countries is that we must all be vigilant and do all that is possible not to lose our attention to preserving lives or to lose the gains we have made over the months. The onus lies not only on government, but is a shared responsibility with the populace. The safest, easiest, cheapest option of achieving a balance between saving livelihoods and saving lives remains adherence to non-pharmaceutical measures, as we have preached so many times. With these measures, we can balance our indices, we can balance and uphold our indices even as we reopen our economy. Thank you for your attention.
Good evening, Chairman, sir, honorable ministers, gentlemen of the press, and ladies. My focus actually today is on the business, the role of the business space as our office space, the role of the employer towards their employee. Well, of course, we know that COVID had a telling impact not only on the health sector, but this global economy. And this has actually significantly slowed down the demand and supplies of many commodities, causing setback for several employers and employees. We've had where people have disengaged their staff because they are not opening. The gradual easing of lockdown has allowed for the progressive resumption of economic activities. Though we are still a long way to go, nevertheless, the role of businesses in halting the spread of COVID-19 is very critical. Businesses are unique in positions to encourage the behavioral change among our populations towards the stopping of the spread of COVID. So as a business tries to navigate the financial and operational challenges of the pandemic, we have the COVID guideline for businesses and employers in Nigeria. Well, we can access this in our website, covid19.ncdc.gov.ng, and the guidelines are there. The guidelines actually reflect the sector-specific recommendations and practices to prevent the spread of COVID in the workplace, as well as give some confidence to employers in ensuring that the health and safety of their employees and customers is assured. Earlier in the year, we launched the Take Responsibility campaign. This idea is the idea behind this is for individuals to adopt the COVID preventive measures and for businesses and other entities to also take responsibilities by adapting key messages to encourage the behavioral change in their society. Some of the things that employers can realistically do to protect their staff and customers and business include mandatory use of face masks within the office premises and having temperature checks at the entry point of the business environment, providing and ensuring there's hand washing facility and alcohol-based sanitizers, displaying signages reminding staff and visitors to maintain good hygiene and respiratory hygiene. Then also staggering working hours. That's having alternate days of working for different groups of people, shift. Then developing physical distancing strategies within the office environment, developing an infectious disease preparedness action plan to reduce the risk of exposure in the workplace and communicating this to all employees, including helplines, the state helplines, sample collection centers, where we have, like in the banking sector, where we have regular face-to-face contact with customers, they to ensure that they have the necessary protective equipment to keep them and the customers safe, and discouraging the use of work pens, computers, phones, even the headphones. Because we have, in some call centers, we have headphones that are shared. That we want the employers to discourage. Then also ensuring that the staff members know the spots for the symptoms of COVID and have a clear understanding of what it is to feel unwell and what to do when you feel unwell. And also have maybe like a holding area within your office space if you have an incident where to keep your staff pending when they can go for the sample collection or pending when they can be taken out of the premises. Businesses must think through how they can be part of the solution as Nigeria resumes the routine activities. We are not going to, COVID is not going to hold us to ransom. We have to start our lives. Everyone has a part to play in sustaining the gains that we have made thus far, and we cannot afford to regress. We urge unions, associations, and bodies representing various sectors to adapt these guidelines to their members. It's only a physically and mentally healthy workforce that can help our economy recover from the impacts of COVID. Thank you.
The Chairman of the Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. So today I'll be briefly talking about the role of private and public institutions in curbing the spread of COVID-19. As we relax the restrictions further, it is important that we remember the importance of adhering to non-pharmaceutical interventions. We continue to observe an overwhelming non-compliance with the non-pharmaceutical interventions that we have put in place. The people in public spaces are not wearing face masks. Even if they do, they are not wearing them properly. This, no doubt, is endangering many lives and challenging the effort of the PTF in mitigating the pandemic in Nigeria. We know that scientific data has shown conclusively that if you really want to fight COVID, you need to have these interventions in place, such as wearing a mask, physical distancing, avoiding mass gatherings, etc. They are a highly efficient form of prevention. When people ask me when is a vaccine going to be available, I tell them there's already a vaccine. It's right there with you in your hands. And that vaccine are the simple non-pharmaceutical interventions we continue to push. It's right there with you. So today we are appealing to businesses and corporate institutions to take responsibility by strictly enforcing the no mask, no entry, no mask, no service rule in order to curb the spread of COVID-19. We encourage people to work safely. We encourage managers to ensure that their staff are working safely in an environment free of COVID. We are appealing to private and public sector institutions to inculcate safer working habits, which still allows for work productivity, such as virtual meetings, remote working, doorstep deliveries, the use of online platforms, limiting occupancy in spaces to 75% or less, limiting the number of people in enclosed spaces such as elevators, providing on-site temperature checks, hand sanitizers, and hand washing facilities, ensuring your workers have access to PPE, and ensuring that when they do wear face masks, they are worn properly and they are worn at all times. Our attitude and behavior towards these non-pharmaceutical interventions will no doubt determine how long it takes before we get over this pandemic. We don't want to have a long tail. We all want to return to normal. The PTF will continue to work with federal and state agencies to ensure all government facilities are compliant. We appeal to private companies and institutions to strictly enforce these life-saving measures in their spaces. And we will continue to work with law enforcement agencies where this is clearly not being followed. We must partner to establish a safe working environment for all of us. Thank you.
The Chair of the PTF, distinguished Honorable Ministers, members of the PTF, ladies and gentlemen of the press, good evening. Since the announcement by the Honorable Minister of Aviation a few weeks ago that international flights will resume anytime from the 29th of August, the aviation sector has worked assiduously to be ready for this date. And the aviation sector, including the airports, are ready to resume on 29th. However, we have other non-aviation logistics we are still working at, mostly to do with the COVID protocols, the tests, and also the online platform. We need to get this all ready and in place so that we'll have a smooth and efficient resumption of the international flights without difficulties for all the passengers. So for this reason, unfortunately, I have to let you know the resumption date has been shifted by 1 week to 5th of September. 5th of September, which is now a sacrosanct date. The initial announcement was anytime from the 29th. Now we have fixed a date, 5th of September, to ensure that a sacrosanct date for the resumption of international flights. In due course, very shortly, we'll be announcing the protocols. Once these logistics are done, the protocols for the resumption, and also we'll be giving further details on the principles of reciprocity that were mentioned. We are looking at the list, we are working on that, and together in a couple of days, hopefully early next week, we'll release this. That's the announcement from the Aviation. Thank you.
Thank you very much, DG NCAA, on behalf of the aviation sector. Now we are switching the format to the launch of the transparency dashboards. We will take 2 video messages from Mr. Asoe Igodalo, Chairman, Nigeria Economic Summit Group, NESG, and Mrs. Ag-E Mokwede, Director, Africa Initiative for Governance, AIG. So are we ready for the 2 messages?
Distinguished ladies and gentlemen, distinguished ladies and gentlemen, it is indeed a great pleasure to welcome you all to this important and historic occasion, a truly historic occasion. Today, the NESG and the private sector are making history with the launch of the COVID-19 Incidents and Response Tracker and Dashboard. At the beginning of the COVID-19 pandemic, the Nigerian Economic Summit Group and its private sector partners swung into action by providing both financial and technical support to governments at all levels to help control the spread and cushion the economic implications of the virus. The NESG and its partners undertook a series of engagements, interventions, and initiatives with other members of the private sector and other stakeholders, which led to different coalitions, including the Coalition Against COVID-19, CACOVID. The CACOVID has from inception mobilized members of the private sector and private sector resources to support government's efforts, increase general public awareness, and provide direct support to private and public healthcare's ability to respond to the crisis. The NESG, in collaboration with the Africa Initiative for Governance, AIG, designed the COVID-19 Incident and Response Tracker and Dashboard. The dashboard primarily reveals the resource requirements across the 36 states of the Federation and the Federal Capital Territory to enable respective subnational governments, alongside the federal government and donors, identify needs and gaps that exist in 3 critical priority areas: testing, treatment and isolation, and contact tracing and tracking. I would like to thank the Africa Initiative for Governance, our funding partner for this project. I thank you most sincerely. I also thank most sincerely the Presidential Task Force on COVID-19, the Nigerian Governors Forum, and each state governor and their commissioners for health, the Nigeria Center for Disease Control, members in the private sector, donor collaborators, for their input and contribution towards the successful eradication of the COVID-19 scourge in Nigeria. The creation of this dashboard and the joint collaboration by all enablers typifies achievable successes whenever the private and public sector actively collaborates. We sincerely look forward to many similar impactful and development-enhancing collaboration. I thank you all for coming to this launch today, and I'm sincerely grateful to all our partners. Thank you and welcome.
AIG, the Africa Initiative for Governance, is a non-profit organization pursuing public sector transformation for improved socioeconomic performance. We provide financing and capacity building to support public sector reform initiatives across Nigeria. We are pleased to have partnered with the NESG and the NCDC towards the development of the Nigeria COVID-19 Incidents and Response Tracker Dashboard. This landmark initiative is a demonstration of what the Nigerian public sector, in partnership with the private sector, is capable of achieving. The COVID-19 pandemic has compelled governments around the world to implement unprecedented response measures to protect lives and forestall economic collapse. Nigeria faces similar challenges, which are made worse by the poor state of our public healthcare system and limited financial resources. Fortunately, our country, led by the Presidential Task Force on COVID-19 and the NCDC, promptly instituted emergency health responses and other interventions which have bought time and space to enable the country strengthen its capacity to fight the pandemic. The NCDC continues to demonstrate through initiatives such as the COVID-19 tracker that it is one public sector institution that is deserving of private sector support. It is clear, as many other countries across the world have realized, that Nigeria will have to rethink its policy priorities, spend smarter, and retool itself to deal with the far-reaching effects of this crisis. COVID-19 is a burning platform calling for change. Here in Nigeria, it is important that we review existing systems and take the opportunity to push forward for change so that we are more resilient and better prepared to handle this crisis and others that may come in future. The launch of the dashboard today marks a significant milestone in our country's response to the COVID-19 pandemic. Beyond improving the transparency, accountability, and governance of resources sourced from the public, private, and development sectors, the predictive analytic model embedded in the platform will allow the Presidential Task Force on COVID-19
to address. I understand it's not here yet. Then we'll take, for a few minutes, the video presentation on Nigeria COVID-19 Incidents and Response Tracker Dashboard, followed by the One UN Basket Fund Dashboard. So, in successive order, let's take the two video clips. Okay, now we'll say a few things about the two dashboards. I invite the National Coordinator, Dr. Sani Aliu, to the podium.
Distinguished ladies and gentlemen of the press, good evening. So today's launch is quite significant. At the beginning, when the PTF was inaugurated, we made a promise. And that promise was to provide transparency across the board, to promote good governance, and to make sure that we continue to partner effectively with the donor communities and the general public in whatever we do. So to that extent, I'm very pleased today that we have delivered on that promise. The transparency dashboards that are coming to life today as a result of our continuous engagement with the private sector and donor community through the Nigeria Economic Summit Group and the UN Development Program. It has taken the PTF through our resource mobilization pillar and our partners almost 6 months of collaboration and hard work to bring this milestone to reality. We have worked across the various streams of government to coordinate and collate data and information on many aspects of our response activities. We have also worked collaboratively to design and test the dashboard at different intervals to ensure that they accurately and comprehensively capture all our activities. It is also important that the dashboard remains user-friendly, easy to navigate, and it's also easy to update regularly. The unending questions about the activities of the PTF, the money we have received, the donations made, the expenditures are now being addressed with these two dashboards. Any one of you can go onto these dashboards to see how we are mitigating this pandemic, as well as the resources required and the resources that have been utilized. And we do welcome any suggestions in terms of how we can improve the dashboard. We cannot forget that these milestones wouldn't have been possible without the adequate support of our major funder, the Africa Initiative for Governance. We appreciate them for their commitment and immense support. I would also like to commend our citizens, particularly the civil society, that have continued to work with us closely to ensure that we do the right thing. We would like to also commend other public and private institutions who have been instrumental in helping fight this pandemic. Collectively, with the solidarity we now have, it should be possible to defeat COVID-19. We must persist in our efforts. We can clearly start seeing light at the end of the tunnel. We have to maintain the momentum. We cannot lift our pedal off the accelerator. But I am very confident that we will win the battle. Thank you very much.
Finally, for this phase of the program, I invite the chairman of the Presidential Task Force on COVID-19 to the podium for the official launch of the dashboards.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, at the beginning of today's briefing, I did inform you of the significant milestone, which is the unveiling of the two transparency dashboards of our COVID-19 response. The first is the Incidents and Response Tracker Dashboard developed by the Nigeria Economic Summit Group, and the second is the COVID-19 Resource Tracking Dashboard developed by the United Nations Development Program. Both dashboards collaborate our focus on a data-driven response, which we have consistently maintained from the onset. Similarly, transparency, governance, and accountability are core values of the Presidential Task Force on COVID-19. And since the inception of the task force, we have been committed to ensuring that Nigeria's COVID-19 response reflects these values, especially in the face of all the scrutiny, mis- and disinformation on the PTF activities. Oftentimes when I read in the media about how much has been expended, I smile to myself and I say, how I wish all that money was mine. Probably you'll be looking for me and won't find me. Since international best practices remain our hallmark, the PTF has been tracking donations and technical assistance received from individuals, groups, and various national and international organizations. I never knew the volume of the donations that we received was that much until when I looked at the facts and the point at which we began our internal procurement. And I asked myself this single question: what have we been using all this while? Then I realized the volume and the goodwill that Nigeria has received in the face of this ravaging pandemic. These donations, alongside the disbursements across the Federation, have been documented and are now open for everyone to see through the activation of these dashboards, which are now accessible on the PTF.
You're watching Channels Television. You've been watching the Presidential Task Force on COVID-19 press briefing live in Abuja. Please stay tuned for Channels Television COVID-19 update. For those who choose to continue to watch the Presidential Task Force briefing on COVID-19, please go to our YouTube channels.